Hello, thank you so much for the opportunity to talk to you about this really important topic. My name's Ruth Crowder and I'm the Chief Allied Health Professions Advisor in Welsh Government. I'm really pleased to hear about the Royal College's new strategic vision and your focus on evidence-based and data-driven care. This is so important and such a key fit with our national direction for health and social care in Wales. Our long-term plan for health and social care, or Healthier Wales, is embedded in the quadruple aim. That's about improving outcomes, improving the quality of experience, making sure that we maximise the use of our resources, which are your skills, to the utmost in order to deliver the best quality care that we can, and to make sure that we are supporting our workforce to be the very best that they possibly can be. And I think that really fits with the professional responsibility that I see is core to our professional practice in focusing on the data and the evidence as to whether or not what we are doing as professionals is effective, is doing no harm, but is making a difference to our patients and clients and their families' lives. So underpinning A Healthier Wales, we have 4 national programmes, each of them equally has a work stream focused on how we improve outcomes and how we focus on delivering the very best quality that we can. We cannot deliver good quality without data and intelligence and evidence. And so the more that you are able to contribute to that, the more we are going to be able to make the case for why your skills are so critical to be accessible for our population. If we want to make a case to ensure that we have the workforce that we need in terms of providing speech and language therapy, then that evidence is central. If we want to make sure that the work that you have done with people has made a difference to their lives, then you need to be gathering patient outcomes, patient goals, patient experience. Those therapy outcome measures, EQ5DL, whatever tool you choose to use is critical. And sharing that information with those who pay for and plan our services is going to be central to everything that we do in improving AHP services. I think I come back as I finish just to my first point, which that this is your professional responsibility. It's really hard, I know. The reason we don't do it, we're not easily supported by good IT that talks to each other. We end up collecting data that's difficult to use or difficult to share. We know that it's hard to demonstrate that link between what you have done and what the difference is for the individual. And that's particularly the case when you are in a multi-professional team. But we have to do that in order to be able to improve and transform our services. The work that you are doing in Flying Start, as I said before, is really groundbreaking and innovative. We need to be moving our workforce far more to being directly accessible in primary and community services. And so gathering evidence, embedding clinical, academic or research posts into our workforce and making sure that we communicate that so that people understand what you bring, understand the value of it, and that you have confidence that your work has made a real difference to people's lives is what I think is going to really help change the outcomes of our population for the future. So thank you so much for the opportunity to talk to you. I hope you have a really exciting event, and I really look forward to working with you as you implement this new strategic vision. Diolch yn fawr.